Hello, everyone, and welcome to our University Business Ed Talk here today, which is entitled Simple Strategies for Reducing the Long-Term Costs of Student Healthcare. And all this is brought to you by the generous support of our sponsor with us today, Wellfleet. Now for some quick housekeeping items, and we'll get right to the presentation since it is a short one today. At the end of our presentation, there will be a live Q&A with our panelists. You can submit your questions below. You can do that anytime via the red Ask Question icon. It's the one with the question mark. And again, you can do that at any time during the event, so please submit your questions. You can also safely download some assets that are related to today's presentation, and you can do that via the blue module. It's the one with the paperclip. It's near the bottom of your screen as well, and I'll be pushing them out at some point if you can't find them. Additionally, at the end of the presentation, after the Q&A, a post-event survey will launch on your screen. So please stay on until the very end so you can take part. We'd love to hear any feedback that you have. And lastly, you'll be pleased to know that everyone who's here today and everyone who registered will receive an email tomorrow from us at UB. That email, it will include a link to the slides as well as the on-demand video. And with that, it is my pleasure to introduce our speaker. We have Drew DiGiorgio, who is President and CEO of Wellfleet. Drew, it's great to have you with us today. You may now begin.
Thank you, Stephen. Appreciate everybody joining the call. We're going to talk about 5 simple strategies for reducing the long-term costs of student health care and why that's important and why we think that the student health insurance business and student health care in general may be a little different than the commercial market. But we want to first talk about how, what causes healthcare to rise? Why is there increased costs of healthcare? And really we think about these bullets here: high administrative costs to deliver care. So this is really about how delivering care is getting more expensive through facilities, methods of technology. It's not so much the cost of professional salaries in that third bullet from a physician's perspective or a pediatrician. Their costs are not rising, but the cost to deliver it and the systems in which to deliver it in they lack efficiency, but also have a lot of challenges with technology and other costs applied around that. So it's costly to stay at hospitals. And then you have this varying healthcare pricing model, which means in any geographic area, any specific provider, costs can vary widely. And the choice of where you receive care and how you receive care can greatly influence what this graph on the right shows, which is trend. And at the end of the day, trend drives healthcare costs. And we see, in the late 2000s, that number was almost at 12%. And we've kind of floated in this 6 to 7% over the last 5 or 6 years, with inflation being low as well. And that's the general market, right? That's what healthcare costs do. When we think about student health and what students use, how students use healthcare, it's really much different than an employee. And what this chart shows here is the need for your student health plan, and as you think about your student health plans and your student populations, to design a plan that really does think about the student. So on the left-hand side, these are the top 10 diagnoses for students. And you'll see here in the yellow: attention deficit disorders, vaccinations, contraceptives, mental neuro diseases, and acne. They're in the top 10, but they're not in the top 10 on the right-hand side, which is our employer-based spend. So cancer, MS, weight loss, asthma, anticoagulants are on that side. And why is that important? Well, it's important because your health plan is typically designed for the right side. They're thinking about the diseases, the drugs, the treatments, the education and processes by which to improve the health of people with those diagnoses. A student health plan should be focused on the left-hand side. Where are my students receiving care and how they're receiving care? So some of these bullets below: a prescription formulary that's built for students. So driving behavior of the prescribers and the students to lower costing drugs for those treatments. If you're running a commercial plan, you're going to focus on the most expensive drugs on your plan and design programs around that. You're going to miss, these 5 or 6 items that are really student health specific. Copay assistance programs can remove cost share for specialty drugs. And if your program doesn't have those, you can ask your health plan or your broker about those. Pre-certification. What are we pre-certing for? Do we need to pre-cert for different things in the student health market than you do in the commercial market? And you can design your health plan to do those things. Number one driver, for our student populations, the way we think about student health is behavioral health. Is your plan designed to optimize both access and the efficiency of delivery of behavioral health? And on the commercial side, there's tools, but that's not where they focus. You need to focus differently on the student health side. Do you have gender affirming care, non-binary specialization that can serve that population? And then do you have the reporting that thinks about your student population to deliver results for your plan so you can optimize those findings? I have a terrible analogy, but you wouldn't put sneakers on a horse and you wouldn't put horseshoes on a person. So why build a commercial health plan for your students that's not built specifically for them? So as you think about your health plan, think about what it is you're offering students from that core health plan perspective, and are you looking at the right diseases and diagnosis for that population? So trend in the student health market actually increases higher, which we would think doesn't sound intuitive. You think the commercial market employee benefits, the trend would be higher. But student healthcare costs rises even a little higher than employee benefits, at least in the last 6-7 years that this chart looks at. We think it's really these four things. There's lack of engagement and compliance with managed care for a student population. They're hard to communicate with, from a healthcare perspective. They think they're invincible in many ways. And in general, they're just harder to reach where they are. And the technology in healthcare today doesn't really fit their lifestyle and the way they think about things. Letters in the mail, for example. They don't have continuity of their primary care physician when they're at school. So really being compliant with their disease management is difficult. And therefore that causes costs to go up. Pharmacy and prescription costs, adverse selection and low cost share and lower consumerism. So, as we think about student health insurance, we have many plans that still have $10 copays or $5 copays, and low deductibles and low co-insurance. So you have lower consumerism. That student's not incentive or doesn't have the penalties that our employer plans have today of seeking care somewhere where maybe it's not as cost effective. So how do you entrench consumerism into your health plan to get that student involved in making decisions? Adverse selection, we'll talk about a little later as we think about waive and enrollment. So those are the issues. Here's the things that we think we should be doing when we think about our health plan. Educate students, educate students. And really the way to do that, in my opinion, is to just simplify the healthcare process. So make it easy for them to find the healthcare that they need, that you want to drive behavior towards. So simplify the healthcare process, improve healthcare outcomes if we educate them. In other words, have better compliance with their disease to manage it. We'll lower their out-of-pocket costs because they won't be bouncing against out-of-network providers or higher costing providers. And those things will help reduce overall the long-term cost of care. If we can give them education about the cost of care, where to seek care that's most cost effective, we'll reduce the long-term cost of care. What else can we do? Now this gets a little bit of inside the health plan itself, but if you think about your plan and you can dive into the data of your plan and publicly available data, you can find there's much more cost-effective ways in which to seek healthcare itself. So reviewing publicly available data to help uncover cost-saving opportunities. Review your specific claim data and help identify high-value providers. So there may be providers that charge the same amount for the same service, but maybe their frequency needs to be, tends to be more, or maybe their outcomes are not as good. There's data out there that can help you choose providers with better outcomes. And then there's reference-based pricing. So when we'll talk about this in a second, but is your plan reimbursing at a level that is financially responsible, especially on out-of-network providers? What tools you use to help pay for that care? And this is going to be a quick example, but if we think about this example of a fractured wrist, you might have an initial provider charge of $5,000 in this example. The actual cost of the provider, and this is a facility, might be $1,000. The network, your Blue Cross, United, Cigna, Aetna networks, or local health plan network, negotiate really strong discounts, 50%, but they're going to pay $2,500 on that $5,000 charge. It's significant savings. However, Medicare, which is the third bullet here, would have paid $1,200 for that service. So somewhere between $1,200 and $2,500 is probably an acceptable amount for that provider. And many plans today are using reference-based pricing to say, hey, from the bottom up, the cost up, we want you to make a fair margin. And we think that that margin sits somewhere above Medicare, but below the commercial PPO rate you have today. And again, this gets a little bit into the details of how your health plan reimburses, but you can see how there'd be significant savings if you were allowed to and negotiate that $1,800 charge versus the $2,500 that's there today. So using data to find out, where that sweet spot is for your providers and having your health plan think about that is vitally important. Pharmacy benefits. So when we think about pharmacy, we think about adherence and trying to get to lower costs. So generic formulas can greatly impact the cost of your plan. This example is 20 to 50%. But we think about 85% of all our prescribed medications are generic. But in that generic class, there's wide spreads of drug costs. So what is your health plan doing, or what can your prescribers do to help steer students towards lower costing generics? And that can be significant savings to your members and the plan. Ending copays, right? If you think about higher copays and lower copays on those plans. So is your plan built, going back to my my first or second slide where I talked about what students utilize, is your plan built to take advantage of those savings? Real results. So this is an example of, just the strategy. This is not a copay change, but step therapy. Everybody thinks about step therapy as a way to help offset cost of higher costing drugs and making them go through the stages of lower costs first. But we found Vyvanse, for example, for ADHD was readily available and affordable, more affordable than putting in step therapy. So instead of making the student go through hoops of choosing different drugs, we just removed the step therapy from Vyvanse and allowed students to get that. So little things like that can save some money. So student provider mailing, of course, gets hard for students, but talking to them about the lower costing drugs that are available to them and having real conversations with your providers, whether they're in-house or in the local community, about, hey, these medications are more cost effective for our students. Wellfleet has a program. We have zero copays on some of these generics, and you can certainly talk to your health plan about adding some lower costing generics to their formulary. All right, this is another one that's a little bit in the weeds, and I think we're doing pretty good on time. Your TPA. Your TPA is the person who administers your claim. So thinking about your health plan, it might be buried or embedded in your health plan, but you might have a third party that manages your claims for you. Does that health plan administrator understand the third party liability that might be out there from your members that may offset some of the cost of your plan? So Medicare, Medicaid, obvious ones. Sports, though. So is your plan covering all the sports injuries? Do you have a sports plan at your facility? Do you want to exclude a portion of sports on your health plan and have your administrator make sure they direct those claims to the appropriate insurance company? When you get into auto adjudication, and many plans brag about high rates of auto adjudication, that just means they're paying a little less attention to what else might be out there for covering some of this healthcare costs. We also want to look at when we review claims. So, those are obviously the first few are methods of other insurance, but do you want to have somebody look at the claim a little closer when it reaches a certain dollar amount? And does your TPA or does your health plan do that? And when they do that, what are the steps that they're taking to help mitigate some of the costs of that plan? So we always want to look at high dollar claims. We don't want to auto adjudicate, without thought and some intelligence around what your auto adjudication. We want to look at claims and make sure we're paying claims appropriately. Prior authorization. So we talked about this on the drug side, but if you're thinking about, your prior authorization list of your health plan, and you're focused on a commercial spend, which has the cancers and other things on there, and you're not focused on what students are on, do you want to have a plan that ignores maybe some of the higher cost things that are happening on your health plan, focus on things that aren't happening? And I think with prior authorization, in other words, having a physician review before allowing some high cost procedures can be helpful in not just making sure there's procedures appropriate, but also directing where that care is delivered. I use the analogy of an MRI. An MRI at a hospital can cost 5 to 8 times more than a freestanding MRI facility. And your pre-authorization provider, your health plan, can help steer those students and work with your physicians towards those facilities. So it's not so much you're going to be able to reduce the cost of the MRI at the hospital, but we can send students to different places and help mitigate those costs and improve the experience. And again, it's that, it's not impeding the access to care, it's directing it appropriately. We find also that in the student health market, there's some red flags that arise on wasteful services, and we see it probably more on the physiotherapy side, but you always want to be conscious of where the spend is, reviewing reports monthly to see if something jumps out as an outlier, whether it's a specific provider that jumps up in your top 10, or a certain type of services that are being spiked out amongst your normal experience. And then asking questions, why is that happening? What can we do? Is that an anomaly? Is it an individual, or is there a pattern or a trend? So I think reviewing your data regularly is vitally important. We talked about adverse selection. Adverse selection implies that you have individuals in the health plan that are going to use the health plan, but that's all you have in the health plan, right? So you're not spreading risk across a broader population. So for student health insurance, you want to make sure you have a well-structured waiver process that assures all students have access to adequate health insurance, which leads to a more balanced risk pool, right? So what is your waiver process? How are you assuring that every student on your campus has health insurance, which helps spread the risk across that population, reduces costs for everybody? Does your student have adequate health insurance coverage? So just waiving, with a health plan that maybe it's offshore, maybe it has limited benefits, maybe it doesn't have benefits in your state. Students coming over from a Medicaid plan that only has emergency services in your state. That puts a burden on your local providers if they can't have a health plan that provides the financial relief for that care, right? So that burden goes to your local provider. So I think it's important to have a tight waiver that also looks at what is the health insurance that student's waiving off with. Is it going to meet their needs at the local facilities, local providers in my community? You don't want to have that student be out of pocket, or worse, not seek care because they don't think they can financially afford it, or need to wait till they go home to get that care. So waiver process, what does it look like? What does a good waiver process look like? There's plenty of great administrators out there that focus on this, and we recommend you talk to them about, hey, how can I optimize my waiver process? Do you require an ACA compliant health insurance plan? Is that a flag you can have on your waiver process? How do you verify that? There's technology today that allows the waiver process to bounce up against clearinghouses to determine what health insurance these students might have, so you can get a little more granular on what health insurance they have and make sure it's ACA compliant. Does allow them to waive with plans that don't provide local care. So this is the out-of-state HMO, Medicare, Medicaid that might be out-of-state. And then, does your plan require U.S.-based claims administration? Some of the international inbound plans can vary widely in the services they provide, pre-existing conditions, and the type of coverage. You'll just want to make sure that you're comfortable with your decisions about what you allow to waive. All right, I'm wrapping up at 20 minutes. So in conclusion, I think there's really these 5 bullets. Provide students with tools and education to guide them to more cost-effective healthcare. Keep it simple. We look every day at our health plan to say, what can we do to simplify the process for that student so they receive the care they need, and they do it in a cost-effective manner. Leverage data to help reduce the cost of care, whether that's your monthly reporting, whether that's the reimbursement levels of certain providers in your area, whether it's the MRI machine at the hospital or the MRI machine that's a freestanding facility. How can you leverage data to help reduce the cost of care? Assure your pharmacy benefits are built for your student population. What is that formulary? How are they deciding what is in what tier? And are you optimizing the lowest cost generics that have the same efficacy as some higher costing generics? Review and update and ask questions about how your claims are administered. What is it that makes your health plan feel confident that they're only paying for care that is their responsibility? At the end of the day, cost avoidance is better than trying to save money. We can avoid costs. Review the enrollment and waiver process to increase participation, but not just increase participation. I'd say making sure that your students have the right health plan. So making sure that they have health plan coverage in your local area. So with that, hopefully that was helpful. I know it was a lot at once in 20 minutes. If anybody has any questions, concerns, or thoughts, fire away.
Yeah, definitely. Yeah, thanks a lot, Drew. As you said, we're now at the live Q&A portion of our presentation. So if you haven't already, you can submit any question that comes to mind, and you can do that by accessing the Ask Question box that we have right there. It's on the bottom of your screen, the red icon with the question mark. But before I get to the questions, so you can take our post-event survey that will launch on your screen after the Q&A. So let's see. I see a few questions in here. Let's get to, isn't my current health plan doing these things? And if not, what can we do about it?
Yeah, I mean, there's a lot to digest in that presentation and that question. I think most health plans, ACA compliant health plans, benefits, right, look the same, and deductibles, coinsurance, unlimited, if they're ACA compliant. So A, is your plan ACA compliant? Does it cover students in my local area? Then I think that's your foundation. Now, are they doing these things? And I would say most health plans do a good job at paying claims that come through their provider network. I would ask questions around other insurance. Are there what is their auto adjudication rate? Is it too high? Are they looking at ways to optimize their formulary, right? We look at our formulary as a student formulary. It's built around students. I think we're unique in that, but certainly there's things you should ask about. How are we engaging with specialty, and how do we do those things? So I think the answer is your health plan is doing some of them. I think this hopefully sets up your ability to ask them more questions to see exactly what they're doing and working through that. I see a few more questions coming in, Stephen. Oh, can anybody hear me? Did we lose Stephen? I think we might have lost Stephen. I'm going to ask this next question. There's a couple of questions here I think I can see. Can everyone hear me? Richard asked this question: can you give us a brief description of Wellfleet and how they may partner with the universities? Yep. So we are a student health plan. So just like your commercial health plan options, we call it the BUCAs, Blue Cross, United, Cigna, Aetna. We're a health plan, but only for student health. We're a unique niche in that market. How do you find more about it? Certainly your local broker, your national broker in the student health market. We can certainly give you referrals into that, but your local broker consultant on your health plan today would know who we are and can give you access to learn more about what we do. Certainly our website, and there's some links, I think, in the presentation that provide you the ability to learn more about Wellfleet and how you can partner. But we're a health plan, so we work through your broker or consultant. or your procurement department, and engage in that fashion.
And sorry about that. I was logged off, but I'm back in. What I'm going to do now, I'm going to push the related content out there on everyone's screen. So I heard you mention that, Drew.
Yep.
So I'm putting that out there right now. So I'll let you get to the next question since you've been answering them.
Yep.
But
so I'm just going to go down in order here. So are there consultants out there that focus? Yeah, there is. So, there's most national brokerage firms have divisions either in higher education or in the market. I don't want to start naming names because I'll leave one out, but your local broker or your broker in the market can certainly help you with that. There are brokers that specialize in the market, and I will, we can help you find the brokers and consultants to do that. I'd be remiss though to start naming them because I know I'll forget one and then I'll get a phone call. Question was, does Wellfleet require the hard waiver? So, we talk about adverse selection. Unfortunately, in the ACA environment with unlimited benefits and no pre-existing conditions, limitations, the market really has dried up from a voluntary perspective. There's some plans out there, and we're one of them, that will consider a voluntary eligible class within a school. So in other words, you might be mandatory or hard waiver for internationals and grads, but you want a voluntary domestic undergrad, and we can accommodate that as well. So, but for the most part, I think all the health plans out there prefer and probably would say, yes, they require a hard waiver. But there are some nuances to that, I guess. And you can talk to your broker consultant about that.
And
yep, go ahead.
No, I was just going to say there was another question that came in. It's in the attendee chat, not the Q&A, so I'll just throw it out there just in case you don't see it. But what are primary considerations that international students should consider when purchasing health insurance?
From an international student, is that what the question is? I can't read.
Yes,
see it.
correct. Yeah.
Yeah. So for international students, I think the things I would look for pre-exist. So the catches are right. So how do they have lower costing international options? Typically, it's because they limit pre-existing conditions. So you want to look at your pre-existing condition clauses. Are you not covering my diabetes that I've had since I was a kid as I come over for 6 months? Well, that's going to limit the benefit you receive. Our claims process in the U.S., the U.S. dollars, are the providers going to accept it? Does it have a recognized logo of a company that is reputable in the U.S.? Does it have an overall cap, an overall limit? If it's purchased offshore, it could have caps. And those are more affordable options, but you have to know what you're buying. And it might have a $100,000 cap versus an ACA compliant plan that's unlimited in nature. So I think those are the three that I would say you want to look for in that.
Perfect. Awesome. Well, it looks like we are at that 30-minute mark there, and I want to be mindful of everyone's time. But I'll say, if we didn't get to your questions, I believe that most of them we definitely did. But if we didn't, we at UB, we will be sharing them with our partners at Wellfleet so they can get back to your questions individually after today's event. And actually, as I go through my closing slides in just a few moments, please feel free to continue submitting your questions if any come to mind. And like I said, I'll make sure they're sent over so they can be answered at some point in the future. And but first, don't forget to stay on until the very end so you can participate in our post-event survey. Like I said, we'd love to hear from you. But first off, I just want to thank you again, to Drew for sharing your expertise and time with us today. We really do appreciate it. And of course, yeah, definitely. Yeah. And thank you as to Wellfleet as well. And I'd just like to take a minute just to thank you, our audience, for joining us here today. For those of you who enjoyed our presentation, we have more UB Ed Talks like this one that are provided by us here at University Business, which is the leader in editorial coverage of news, trends, as well as current issues in higher ed. We have a wide range of readers who subscribe for free to UB, and they stay up to date with us via our newsletters, webinars, and our UB Ed Talks like this one. Also, last thing, if you would like to watch this presentation again, or for those of you who believe that the solution provided would be useful to your colleagues, and I'm sure that would be very much the case, You'll be pleased to know that our team at UB, we will be sending you an email later tomorrow. That email will include an on-demand recording of this presentation, as well as a link to the slides. And again, I see there's quite a few of you still on, so make sure to stay on again to the very end to take part in our post-event survey. So with that, on behalf of UB, this is Stephen Blackburn. Thanks, everyone. Have a great spring semester, and thank you very much again. This was great.